Planetary health, we talked about last session how that is a growing concept and what that entails. And what lessons can planetary health draw from how we learned to be environmentally aware? We have Sverker Sörlin here, who is an environmental historian and professor at the Royal Institute of Technology. Your speech is here already, Sverker. Welcome up.
Thank you very much indeed. And you hear me, right? Okay, very good. You have to trust technology. I am going to speak to you today about really a kind of question that I find as intriguing as I hope you do, namely, where does all this come from? We're sitting here today agreeing on many things and disagreeing on others perhaps. And it has happened pretty quickly. We think about 2015 as an important year, for example. But is there any deeper history hidden behind this? And I think it is. So that's what I'm going to talk about. And I have worked on these kinds of things for many decades. So it's hard for me to finish in 18 minutes, but I will try. And I will start by saying that this team is a team I've been, on top of other things, working with right now, focusing precisely on these kinds of questions, digging into the history of planetary health, and to some extent One Health as well. It's based very much in Australia, and I'm sort of the odd man out. Harvard University is also involved, otherwise it's mostly Sydney. So I just wanted you to see all these friends. And that's a little bit of the papers we've been doing of late. We publish both in medical journals like New England Journal of Medicine. We have just a new article coming out in Lancet, but also closer to the social sciences and the humanities. I want to say at the outset that it's a bit puzzling that this marriage between health and medicine and environment didn't happen big time earlier. And you will understand this statement better in a moment. But I would like to cite a special issue of a journal in my field, History of Science, that came out in 2004, where the co-editors Greg Littman, Michelle Murphy, and Christopher Sellers observed, and I will quote this: "Environment and health have long been seen as having separate histories." Not only being separate, but having separate histories. So I'm trying to sort of overcome this problem today a little bit. And why don't we move very fast, far back in time at the very start? If you go back to Mesopotamia, they were already aware that, to the extent, they didn't use the term environment, of course, but they knew what health was. And in a story of Gilgamesh, way back in the Mesopotamian kingdom, he beats wild Enkidu and brings him to the city of Uruk, where Gilgamesh, of course, is the ruler. Gilgamesh cuts down forests and stirs up the environment, and Enkidu dies. And Uruk is punished for the environmental sins committed by Gilgamesh by floods, drought, and disasters. Precisely these words we hear today. People die from disease. So that's a story, it's a narrative from that period, and it's about this relationship between doing the wrong things to nature. And we find other examples later on. This is the would-be, at least, author of the famous 400 BC manuscript called Airs, Waters, and Places. And this is Hippocrates, as many of you already noticed. And he was basically very interested in one idea that is also important as a kind of a basic trope of our story today, namely the balance between nature and the human body. And he of course, thought that there were 4 bodily fluids, and there were corresponding 4 elements: earth, water, air, and fire. And these should be in good balance and harmony. Otherwise, what happened was that you got sick, and the world got sick too. So that correspondence was there. So when we now start thinking along these lines again, we have a lot to build on, in a sense. And we, in a sense, feel as if we already knew this, but I think we have still a lot to learn. And the sobering reflection, I think, is that in the several thousand years that have passed since these texts, Western culture and Western science have really worked hard to distance the human from the surrounding world. The Christian dualism between God and human soul on the one hand and the organic natural world was like, it was a very successful idea, Christianity, but it built that kind of rift and this gulf. So the modern understanding just accelerated that. Since the early modern period, 1500, 1600, around the times of Columbus and Copernicus and all of that, that widened that gulf even further. And what followed in the 19th and 20th centuries was an excess of technological and medical optimism that proposed that we could use knowledge to make humans and their bodies and brains function better without considering the surrounding world. So that was what happened over many, many hundreds of years, including then, of course, the great world expansion that Europeans did, and wrecking ecologies all over the place around the world, but so far not paying back. And I've actually brought in an image of this guy also, because he had it all wrong, so to speak. He thought that in a book, 2015, this is Ellsworth Huntington, was his name, he taught at Yale University. So he thought that civilization was really a product of climate. If it was a favorable climate, you got a good civilization with creative people. And I wouldn't explain these little graphic representations, but that you see the concentration in the United States, and particularly the northeastern part. That was the most favorable climate where people could think the best. And he was himself teaching there. And where did he get the information from? He had written to 200 colleagues around the world, a good sample of friends. And that was his empirical foundation. We have moved forward a little bit since then. But the thing is that he was thinking about a relationship that is important between climate, between the surrounding world and the human. So he asked some tough questions. And you could say that this was, this kind of psychological racism was meaningless in a sense, but soon it turned around. So the old environment, or the old climate outside the human that he thought about, he thought was a force that determined human behavior from the outside, and the adequate response was to withstand it. And I think that shifted very, very much, and this is a very important historically. Important moment, and one that I like to talk about because I've been working a lot on that, and you see a couple of the books we have co-authored there, and you find the authors as well on that screen. So right after the Second World War, a totally different interpretation of the human-Earth relationship started to emerge. This was manifested through a sequence of publications and books and conferences. I mentioned just a few of those to have you notice this. One of the most famous books that came out and capturing this moment in the post-war period was by this ornithologist, William Focht, who had been traveling in South America to find out about biodiversity, we should say today, on the commission of several governments in Latin America. And he found alarming results. There wasn't as many species that there had been before. Some important birds were gone, and he loved birds. So he wrote reports to these governments that were quite upset. And he started thinking that maybe this wasn't all right. And he was very interested in population growth. That would ruin the world if populations became too numerous. So, and because humans would then exhaust the resources and ruin even entire countries. He was very concerned by that. And others, a few wrote similar books, and he started using the word environment. This book you see there, Road to Survival, translated to countless languages, became sort of a breakthrough idea, you could say, for the modern concept of the environment. And just a few years later, you find books like this one. There was a concern for the man's future, you could say. How long would resources last? And you saw graphs, similar ones almost, an hour ago. But this is misunderstanding quite a bit, as you can see. Very little of the fossil fuel resources have been consumed. and peak will come in this millennium, and that will be several hundred years into the future, as we can see. But one thing is missing. There is no CO2 here. There is no downside of the use of this. It's a resource that can be used regardless of temperature. And that's another critical moment in the 50s. Princeton, the famous conference on man's role in changing the face of the earth. And that was really what was then appearing, dawning on people that this is actually going on. Changes are vast and comprehensive. And in just a little bit of time more, there's the International Geophysical Year in the late 50s, 57, 58, when a big monitoring project was undertaken with 60 nations working together. Most were scientists, a small handful of social scientists, and they started mapping the world in very much geophysical terms. And also at around the same time, you have these nuclear blasts, nuclear testing, and various nuclides started traveling around the world. And this, I would say, famous article from 1956 by Magda Listen-Hubert mapped this. It was only weeks between a blast and where you can find it in organic material and in human bodies. So you could say that was also really the beginning of a new kind of globalization, an understanding that we were, so to speak, sharing fate around the world. This image is, of course, much more recent. And now we talk about teleconnections and immediate connections between what happens in one part of the world and the other. But that was not known really at the time. Now it's commonplace. But so we see something starting to emerge here. And in 1962, this very famous book by Rachel Carson was published, and she caught, apropos what we've been saying here about narratives and capturing the imagination of ordinary people. She did that. Her book was pre-ordered in 250,000 copies before it was even printed, because she ran a few chapters in the New Yorker as a feuilleton. So by that time, when we're into the 60s and Earth Day, you can see there in the beginning of the 70s, then it has become precisely a movement. The environment was we realized as a collectivity. And apropos the discussion just before the break here, we have known this for so long, and still so little has happened actually to really break through. So that's another sobering kind of thing to say. Now, some of this, what I'm just saying here, we have just captured in this article from a global study of global environmental governance, of how that has evolved. And of course, that's one among the attempts to actually try to make something happen in this area. And now we also have this quantified in many ways. We again saw slides of that before, but there are other ways of representing this reality. And it's very important to see how this is also done through big infrastructures. Ice cores become the translating unit of data. You can translate it, this data can travel, it can now be applied to global environmental objects in the oceans or in the tropical forests or wetlands and what have you. We end up with these kinds of diagrams, which is the sort of early phase of the Earth system science that Johan talked about before the break. And again, that's a kind of prerequisites in order to come to the kind of understanding that we have seen before the break. And then we have, of course, the publications related to the UN Stockholm Conference in 1972. And I would like to particularly focus on Barbara Ward, the British economist, who very early on started thinking about how you could balance the demands to stay within some limits, the geophysical limits, and at the same time have a lower kind of limit for the minimum income, the minimum welfare for those that were somehow affected by this plunder of the planet. Her co-author of this book is so in this, there you see René Dubos, who was a medical guy, and Barbara Ward wrote together this Only One Earth for 1972. And then you start to see a language meeting, the trends I've been talking about start connecting now with the medical language, the pathology of urban and suburban life, the anti-physiological leisure, we're too lazy, in a mechanized, automated, and crowded environment, and so on. Man, Medicine, and Environment. These books also start to appear in the 60s and early 70s. And more of that is taking place connected to Ward with Kate Roberts' work in Donut Economics, for example. And you see ever more sophisticated ways of, for example, writing articles on planetary boundaries and the whole set of concepts on the right-hand side here. Somebody mentioned Stockholm before. Many of these have particular connections to Stockholm. But there was also an older tradition of disease ecology that was sort of mingling in here. So here we have Frank Fenner, who was given the name of Fenner School to the famous ANU in Canberra Institute. And we have also another Australian here. Many Australians actually being interested in this, maybe to some extent affected by the project I'm working in. Stephen Boyden, who works in human ecology, makes a fabulous study of the total ecology of Hong Kong as a city where he worked for many years. He's still around, 100 years old. And then maybe one of the voices that I myself find most interesting in the prehistory of the current planetary health development is this guy, Anthony McMichael. Global ecosystems are today coming under threat from a resident species, that is humans. This is a first time in Earth's history. It's a dramatic development. And he collaborated with another guy with origins in Australia, but working a lot in London. And they wrote things together. His name is Andrew Haynes. Anthropogenic climate change greatly extends the temporospatial scale. So it's again the humans that somehow expand beyond where they should be and create all this negative impact on the environment, and that hits back. So it's now becoming, in the 70s, 80s, and 90s, a circular thing. We're sort of hit back by this development that we have ourselves provided. And towards the very end of his life, he writes this book with some assistance from co-authors. Cameron Muir actually is an Australian historian that he worked with, he's now gone. Climate Change and the Health of Nations. And now you could think about all these things together. So what I'm trying to sketch here is kind of an evolution where more and more dimensions are coming together. And reasonably late in that development, it happens with medicine. And so it's really high time. And one of the people who have been contributing also in this development very much, I want to show a picture of here, precisely because we're in the very same room as Will Steffen was when he was talking about this some years ago in an anniversary event for the first version of the Planetary Boundaries article that we did back in 2009. So I thought that might be timely to show him also. He passed a couple of years ago. So this is another motto we are following, but I think there's a rich and somewhat surprising story behind what is now coming together between the environmental and the planetary health dimensions. So thank you.
Yeah, from history to action, our next speaker, Mr. 2-3%, we remember you from before, will reflect on how the time now calls for action rather than more science. But what type of action and how to achieve results? Martin Herrmann is chair of the German Climate Change and Health Alliance. Most welcome.
Thank you very much for the invitation. I kind of knew when I would speak as a seventh speaker that all what I would have prepared, I would have to revisit. So I will partly have to improvise, which actually is in itself a good message. Because when we recognize a planetary health emergency, and I don't have to explain it after all what we have heard, the main question is how can we act? And it is not an academic exercise that I can give you now a talk on, that you now can all the solutions from. So I'm nervous about it, and you could see also I get very passionate because we have so much kind of misunderstandings when we look at moving from a diagnosis, facts, evidence, knowledge, to transformative action. And you have played out, and all have played out, how much we have a need for large transformation, for large transformative actions. And it is very clear that it is as urgent as it can get, because what is at stake? It's our home. Our home is at stake. So a few comments before I show one slide, which kind of explains it all, and then I tell a bit about our story of what we have been trying to do in Germany, and I give one example to this. So the comments. A lot of people think when they have the facts, the evidence, the diagnosis, we just have to go in implementation. And you all know that big companies, I've worked with large companies, I've worked with the WHO, I've worked with Gavi, with the global vaccine, and they all think implementation should be easy, but it is not. And of course, the more complex it gets, the more difficult implementation gets, and the more improbable implementation gets. Implementation is not something that is happening because we are so smart as scientists, because we shift the realm. We move from natural science into social science, but can the social scientists really explain out how to do it? No, so it really is more a shift to the social actors, to the social players, to the social nets. And I would actually suggest to rename the conference from connecting the dots to connecting the action nets, because connecting the dots is not enough for what we have in front of us. So that means, with regard to acting with these kind of complex challenges, the biggest mother of all challenges we have in front of us, we also need to confront that we are ignorant. Necessarily we are ignorant. And only when we embrace our own, our collective, our joint ignorance with regard to how we can win others into getting into the game, to making the most urgent thing on the planet really matter in what we do now and today and the day after today, and how we relate to each other. How do we relate to each other as rich people, as poor people, as doctors, as nurses, as physicians, whatever we are, how do we relate to each other? So, what we also need, and we have heard it today, is being in connection with what this former minister was saying, the oceanic feeling. The religious feeling that is not connected to a religion. We need to be touched by the gift of being alive. And of the gift of giving something to my kids and my grandchildren. I have 4 wonderful grandchildren. So why do we have to care? Why do I care? And what does it cost me not to care? What is the price that I have in my life if I put it aside? Why is it important? When we act with others and we come from a certain sacred place, knowing all the science, our communication shifts and we get more vulnerable. And it can be this oceanic feeling, it also can be the blue marble. One of the great gifts we have in Germany, the kind of German David Attenborough is our best friend, Harald Lesch. He's the best science communicator we have in Germany, and he's an astrophysicist. When we do joint talks, what he's usually starting with, the blue marble or the story of the blue marble or the story of cosmology, how incredible and probable it is that we exist. What a gift. So if this is in the space, and now we look at the diagnosis, we have a much larger space from how we can then see what does it need from us to move forward. And the third thing to take into account, as medical doctors and also as scientists, we have been sleeping to this connection between health and climate and health and planetary health. Until 5-6 years ago in Germany, and I think mostly also globally, 99% of the players have been sleeping to it. They have not been actors. This is shifting slowly, but it's important to bear in mind. In Germany, for example, you have about 10 million people who work connected with health. To scale education for 10 million people, it's quite a thing. To get them ready to act, to revisit their whole system of how they're understanding medicine is quite an act. I'm very grateful also that an historian was talking before me, because we also need to have this historic perspective. Because what we see when we take the historic perspective, our generation and the generations before have been creating what we have now in front of us. And this is one of the reasons why it is so difficult to confront it, because I've been failing. And only if I can confront that I have been failing, I then can be free to act. Otherwise, I have to compensate and put things aside. So, I don't have to explain this. I'm just explaining. This is usually a graph I show when I do large public talks. Within 2 minutes, nowadays, people understand what mess we are in. It doesn't take a long time. 2 weeks ago, I had the chance at the German Congress for Internal Medicine to give a keynote after someone from Doctors Without Borders. Yeah, so he had kind of prepared the ground. I could talk about the 1,000 internal medical doctors in a keynote. So you show it, you speak for 1 minute, people understand. And now comes this key slide. Who has known this slide? Who knows it? Some of you. Now, in a way, what is on the slide we have already heard today. So we have climate change, it's connected with biodiversity. This was actually new in this 2022 IPCC slides, that biodiversity is so closely connected. It's connected with human society, it's urgent, we need to act. Now, how should we act? It should, climate resilient development. And now comes the thing that was new and I have not seen before in any report. Why? Because of human health and well-being. This is the core thing why we have to do it. Equity and justice, ecosystem health, planetary health. It's the first IPCC report that is in there. So that's a why. And only if you have a why and understand it, actions will be powerful. Now, what does it mean for health professionals and doctors? If this is so, and I think you understand the slide, what does it mean for us as medical doctors and health professionals? We are placed to lead this. We are placed to be the advocate for this. We are placed in our conversations to patients and politicians to explain what is at stake in a calm way, in a clear way, in a compassionate way, but also in a rigorous way. And if we do that, and if more and more understand that it is also a privilege to do it, it is our duty, it is our responsibility, it's a privilege to do it, we will communicate it in a way that it is going to be a game changer. That is what Johan was saying before. I remember when we invited him for a first Planetary Health Academy session in front of 1,800 people during the pandemic, he was saying exactly that. So he understood what role we are playing. So how many minutes more I have? This is how we started our organization in 2017. 15 people, we understood the case, we understood that Germany is sleeping. This was what we wanted to change. 3 objectives, it's still the 3 objectives we have today. You educate, you put it on the action agenda. It needs to be on the agenda. Second one, consistent implementation within the health sector, within our clinical work, within our educational work, with research, with getting down to emissions. Third one, playing a strong role in the transformation of society in German-speaking countries and at the global level. What have we achieved? All major medical societies, the psychotherapists, the physiotherapists, the nurses, all of these societies, the health insurers, all have it on the agenda now. So kind of with our first objective, we are very far. We are starting to get into our second and third objective, but this is of course much more tough because now you need to redirect finances. You need to redirect the game that doctors and insurers and everyone else and the politicians are playing. So this is where we are kind of up front now. But the real progress we have is that we were able to get all the great institutions into the game and share kind of the key information. And what is interesting, once they get into the evidence, when you get into the evidence, it takes over. It takes over. You cannot put it aside any longer because when you are trained as a medical doctor or nurse to really read the evidences and it's put together in a way that you understand how it impacts your praxis, people are not going away independent of if they're conservative or green or anything else. Why are we not acting? We've had it, there's a lot of disinformation campaigns. There's a lot of kind of investment into delaying and trivializing. There's a lot of repression of things. And there's a lot of resignation and paralysis within the people who have understood but don't think that they can change something. So it's really important that we are making clear to people, yes, they can change their behavior, but even more important, they can grow up as a citizen and raise their voice to politicians. That's very important for us. It's also very important for the subject, that we kind of stand up and raise our voice, which also means that we have to reinvent and reinterpret what it means to live in a democracy. What a great thing it is, but it's not something to consume, it's something to create and recreate in front of the challenges we are facing, which is another thing. When you're really facing up to what is in front of you, it gives you dignity. And it gives you pride to be part of a movement who is not shying away, but growing up to who we are. And that's what I'm actually doing in a lot of talks. When you talk like this to people, it's not shutting them down, it's actually empowering them to do the next step, which doesn't mean that they need to do everything. They just need to start in their own environment and they find ways of doing this. So heat, this is the example I want to show to you. In 21, we did with the Lancet Countdown Policy Brief. It was clear, we did some interviews, and it was clear we are not prepared in Germany. And I had enough of doing another recommendation policy brief. I said we have to shift something. So I talked to some of the players in the countries and in the medical association, and we said we will shift from making recommendations to action. And what we did, we created some action alliances, health action alliances in some countries, and then also in 23 across Germany. This is now from last year's Health Action Day. And you have the head of the Chamber of Doctors, you have the Minister for Health, you have the head of one of the big welfare organizations, the head of the Family Doctors Association, you have the head of all the insurers, you have the head of the hospitals, you have the head of the Nursing Association, and you have me. Representing 50 other organizations, this year we will have over 100 who are working with these values. We take responsibility for heat protection. We inform ourselves. We implement heat protection measures in our own area. We initiate and participate in heat protection alliances. We are available as experts for politicians. We educate the public. We integrate heat into research and teaching. This is kind of the values from where we act together. And it's actually very interesting when 50, 100, even more organizations work together and you trust that they start implementing stuff in their own area of responsibility, a lot is happening. Now, what is coming to this year, these are the different kind of influencing factors that lead to heat resilience on the different levels, from community up to the state. Yeah, so it's building on communities, of course, highly relevant. What is also important is that we get heat protection into building and city development. Yeah, for example, in Germany, billions and billions and billions will be invested in the next years to have a shift in the whole thing in order to get to carbon neutrality. So far in Germany, heat protection is not part of this work. So this is one of the things we are shifting now. Also, the insurers need to see it's not enough to say planetary health is a great idea. They need to revisit the way they are spending the money and shifting it around. So these are all the organizations and more to come. What is an action agenda that we try to implement with everyone? The first one is, again, that this is the multiple win thing. Shift it. Just one thing. We need to get away from the co-benefit conversation to a multiple win conversation. It's much more stronger. Co-benefit is not a strong rhetoric figure. Multiple wins is. And we need to understand when you move into the direction, it's not just a small co-benefit you get. You get huge wins in many different dimensions, and we need to be able to communicate that. So, social tipping dynamics we have had. This is the 2-3%, the scientific evidence behind it. And this is how you start a big change, similar to an infection. One person gets infected, you have some good multi-spreaders. I hope this is a hot event here, a hot multi-spreader event here. And key actions, again, all the key things. This is something that I was showing at the Congress. And I have 1 more minute. Yeah. I just want to invite us to see what key role we can play. And really to dive into the unknown, also with regard to ourselves, because every one of you is much more talented to act also in the political domain and in whatever area it is when we understand what is at stake. What I've really learned is also to reach out to people and to speak up in moments where I normally would not have spoken up, because I'm passionate about what is at stake. And I know we together can really shift things. And it's very important that we spread these messages in how we educate our students, how we talk to each other, and that we do it, of course, in a spirit of multi-professional kind of recognition and work. We need to also, as doctors, step down and learn more from the other health professions. But we really also need to step up to lead the politicians and our public. And I really hope that we make a lot of progress together also in these days, because science in itself is not enough. We have had enough of evidence. We really need to get it to the people, and we need to find different ways of doing it. Thank you very much.
Thank you, Martin. I think this call for stepping up for doctors fits like a hand in a glove for our next speaker. The effects of climate change, extreme heat, wildfires, food insecurity, air quality, etc., will of course affect human physiology. Yet doctors have so far little training in understanding these changes. So Jay Lemery, who is a professor of emergency medicine, has come all the way from the University of Colorado School of Medicine, is here to talk about a new type of training of doctors to mitigate changes. Martin, here is one of the people you're looking for.
Great to be here. I received this scarf as a speaker's gift earlier this year, and it was wonderful. I actually didn't think I'd ever wear it. Other than then, I had my name on it. And Maria, thank you for making us bring the color.
Yeah, excellent.
Because here we go.
Yeah, perfect.
There's some color.
Yeah.
And we're up and running. It's great to be here. My name is Jay Lemery. I'm a professor of emergency medicine. I'm also a endowed chair in climate medicine. And you may be like, well, what is that? And it's a great question, because we sort of invented it to be a provocative statement to say, what is climate medicine? Is it a thing? Does it even exist? And what we're trying to do is normalize clinicians leaning into this. And it was meant, again, to be a provocation and to be able to have a conversation. A little bit about me. I trained at Bellevue Hospital in New York City, about right next to where that boat just crashed into the Brooklyn Bridge. And finished my training in the mid-2000s. I got involved in wilderness and environmental medicine, which is how you take care of people in remote and austere places. This is where I grew up. This is Lake George, New York, in the Adirondack Mountains. Maybe it could be a Swedish scene. And I say this because I didn't come to this from a traditional public health approach. It was really clinical medicine in austere environments, but also beautiful environments. And around the same time that we were creating a program around this was around the same time where, at least in the United States, climate change began to be politicized. And we were, surprised in the science community, maybe it was naive at the time, to think that there was going to be a big debate moving forward, and that this is a part of a normal cycle to the extent it's caused by man, right, or human. And a few years later, we saw a senator carry a snowball on the floor of the Senate and say, how can climate change be real when it's so cold outside? So this really provoked us in medicine to be like, we want to join those people. We need to be working with those people. There really were no those people. I think Jan was the only person I even knew at that point. And around the same time, my mentor, a late mentor who passed away, wrote an elegant treatise in JAMA, Physicians in the Environment, which was really explaining why we should care. And it struck a chord with me, and it's really held up well. And this is really what started this journey, which led us to create an offshoot of that wilderness and environmental medicine to a climate and health program. And I think we're the only funded program at a school of medicine in the United States. Most of our peers are in schools of public health. And really it's about using that power of science communication, bringing what we do as clinicians all day long, bringing our evidence to the bedside and reframing that dialogue, right? This is an older slide, but I think everyone here gets it, which is let's get away from polar bears on icebergs and make the face of this kids with inhalers. Get away from abstractions like parts per million of carbon dioxide or altruism, save the whales, love Mother Earth. I love my mom and I love whales, but it's a very different part of your brain and different part of our risk assessment when we talk about our parents' risk of chronic lung disease and our kids' risk of asthma. So just thinking a little bit more about that, when we thought about this, like how do we actually communicate climate change? I've called it a disease. I've been called out for calling it a disease. I think it's the right paradigm. It's a disease of infections, right? Vector-borne disease, respiratory distress, degraded air quality from wildfires, food insecurity, you guys know this, waterborne illness, heat stress, mental illness, displacement and trauma. But really when we contextualize it with what we've seen this past year, right, in some of the grand disasters of Southeast Asia, the flooding in Brazil, and of course California, I've come to the conclusion that it's a disease of vulnerability and disasters. Okay, thanks very much. That's my talk. Just kidding. That's where I used to end it, and now I've evolved. It's a disease of ineffective communication, systems failures, and a lack of leadership. So we have this imperative to lead. How do we fill this void? How do we step up? How do we mobilize the clinical community? And we've done it in many different ways, but really we're building new educational pedagogy to think about what does a climate doctor look like. Now, I'm not sure that's the word. That may not be the right term, but I think it's intuitive. I think you get it, and we're going to keep doing it because, again, it's provoking the conversation. We started a physician fellowship post-training, residency training in 2017. And we did it one physician at a time, which is, of course, woefully inadequate for the crisis that we're talking about. And we envisioned what are the competencies that doctors need to know? Well, it was pretty straightforward. We talked about fluency with impacts, so pathophysiologic and societal. Concepts of mitigation and adaptation, this sounds very familiar. Thinking about programmatic development, how do we get them to go build? And again, they were pluripotent. We're not necessarily saying you need to go into academia. We want to put them in all facets of society where health can be informed. And of course, outstanding science communication skills. But since then we've evolved. It can't be just no. It has to be, you have to have credibility. You have to have the knowledge, but you also have to have effective leadership. And that's really been the evolution of our program. Having deeper dives in fluency. If we want them, our graduates, to go out and spar over smart policies with business, community leaders, and policymakers, we've got to go deeper, and they're going to need more skill sets. We know that across the world, global policy has stalled, been anemic, not been as robust as it could, because this is really hard to talk about this to the lay public. Making those articulate linkages between heat and geopolitical instability, loss of biodiversity and pandemics, extreme weather and food insecurity, right? We know how hard it is to get people, certainly in the United States, to just get vaccines, right? This is challenging stuff. It's not intuitive, and we really need to be able to get people, get our graduates to be fluent in all these things beyond just clinical medicine. And of course, the most fluent thing they can be is talk about climate change as a disease of vulnerability. To put it another way, the poor and sick are going to get pummeled, right? That is the grand message to take home. We've put this together. We have written several papers on it. This is just the latest one with the National Academy of Medicine in the United States, thinking about how do we strengthen education for clinical health professions. So doctors, nurses, but we're also looking at different phases. So absolutely, we are leaning into undergraduate medical education. That's medical schools. We're looking at graduate medical education, the fellowships, but also continuing medical education. So what do we do with us? It's not particularly this room, but our age group, right? So people that are a little older, maybe we've been called dinosaurs a few times by the younger crowd. How do we mobilize us and get us fluent practicing clinicians? Because we just cannot wait until our medical students get out, get good at what they're doing, and become leaders. That's a decadal process, right? Way too long. When we think about what are metrics of success, we think about our fellows as being a trusted resource for climate resilient policies. They can credibly address environmental justice issues and convincingly explain the benefits to the health policies that we're advocating for and putting forward. We have 5 fellows a year now. This is just our current batch. And what I'm most proud of is that we have many different specialties. I know this is the nephrology corner over here. We need some nephrologists, guys. So if you can bring that message home, that'd be great. But you can think here, some of the things are more intuitive. Family, internal medicine. Okay, that is more pediatrics, generalist generally. But neurology and neurosurgery, actually do that. We were very proud to get them. And I said, why do you want to do this? They're like plant-based diets. You know, it's all about cardiovascular health and the havoc that the meat industry has on worldwide on emissions and water use and land use and so forth. Radiologists are awesome at understanding the healthcare impact of the carbon impact. We'll talk a little bit about more of that in a second. We have, with our fellows, we have nonprofit partners and federal partnerships. And this was really our flagship to get our fellows into where policy is being formed. For those that haven't been paying attention, there's some stuff happening in the United States right now. And our federal partnerships now, we have decided that they're no longer viable to do in the next few years. So we're looking for other opportunities. One of the big things we did is at the UNFCCC conference, COP, last year. We got together with our colleagues at Greener NHS England, and the National University of Singapore. And the reason we did these 2 institutions, because they're the most advanced where we are in terms of fellowship and physician training. And we said, let's get together, let's be the group that puts together the work that we've done. Let's build a template that is replicable and that others can join. So by no means was this meant to be exclusive, but more of this is a great audience to be in front of. How can we work together? Who's interested? Who has space for our fellows? How do we build this community of practice? And these partners are dynamic, forward-thinking, exciting. What about the rest of us? So I got a call from a dermatologist that lived in Tampa, Florida. She had said, I have 3 kids. I've been practicing for 10 years. I don't have time for your fellowship, but I need to do this. What do you have for us? And the truth is we had nothing. So we began to think about it and say, okay, let's build the penultimate continuing medical education experience, not just for doctors, but for nurses, pharmacists, anyone who touches a patient and says, come on into the tent. Let's work together and really transform healthcare. We call it the Diploma in Climate Medicine. It's a heavyweight. It's a 300-hour credential. We sort of invented it, but we really looked to what else is out there, and we looked to the Diploma of Tropical Medicine and Hygiene, a very successful program that clinicians from all over the world attend. And here are the many different places where the DTM&H is offered. So again, we're building it to be replicable, to partner with other institutions, and to disseminate this knowledge. This is a group that we probably have about 15 graduates a year. It's kind of new. Again, 15 care providers is just pathetic for what the world needs, right? Here are the different topics that we cover. So foundations, healthcare system sustainability, disasters, energy policy and healthy communities, and then grand systems and policy things. You can see here some of the grand challenges that we have. Important to know that we have cross-cutting themes in climate justice, communication, leadership, and recently added disinformation. How do we combat disinformation? And leaning on the science that tells us how best to do it. Just real quick, one of the fun things is we go here. This is the National Center for Atmospheric Research in Boulder, Colorado, right next to Denver. And we have our doctors do climate modeling with the scientists. Why on earth would a physician do climate modeling? Well, actually, there's no reason that they really would in their day jobs. But we can then incorporate that into their narratives and moving forward and to say, I see where the raw data comes from. I've worked with it. I've talked to these people. They're very smart. This is how they put it together. And this is how we take that earth science data and translate it into impacts upon our patients and communities. So we're building those bridges. We're being interdisciplinary, and having a pretty good time while we do it. Again, building that sense of community. Healthcare system sustainability. Hold on to that thought. We go to Disaster City. You can see here. This is a campus in Texas where it's truly a train wreck. They have a lot of different things there, and we run big. They have a disaster curriculum that's world class. Go out to lithium mines, wind farms. Do windmills really kill precious birds that took down the Texas power grid and caused the blackout 2 Februarys ago, right? Looking at those issues and again, using that together to combat disinformation, as well as fracking sites. What's the real impact of a fracking site on a community? And then systems and policy, thinking about global policy, national policy. I put this in here. I just want you to pay attention to this because this is actually something I think could spin off and become something big in its own right. Healthcare system decarbonization is a big trend, both globally. The WHO has what's called the ATTACH Alliance, which I don't know if you haven't heard that before, but it's a place for all of us to think about how to decarbonize our healthcare systems and impact. As well as the National Academy of the United States is really moving on this as well. A lot of data is now coming online. You've heard from many speakers about Lancet. We are going to need to digest these data of our own operations, think about mitigation and adaptation, and then think about actions that have a patient-centric posture. And I'm talking about decarbonization here. In the United States alone, healthcare is 8.5% of the American carbon footprint. So we are a heavyweight. And so one thing people are working on, I just put this here because I think it's actually quite interesting, is big, huge data set. What do we do with it? How do we make sense of it? This is actually where AI, artificial intelligence, and large language models can start to put things together that no human could actually do and think about how do we separate signal from noise and changing processes within our healthcare systems, and to do this efficiently, to improve patient care, and to decarbonize our systems. So, finally, let's take a little stock take of where we are. I don't need to tell you this; we've been hearing it all day. The climate continues to warm. January was the hottest January on record. We have an incredibly destructive story in the United States, in Los Angeles. I was there a couple weeks ago talking to people, and just another example of how this is the cascade continues. And I wanted to affirm the fact that we are trusted messengers and look to our predecessors the International Physicians for the Prevention of Nuclear War, who had great success here. I think in 1985 they won one of the Nobel for bringing a health lens to an existential, multinational problem that no individual or even individual group necessarily felt empowered to change. And they were unambiguous and they were clear. And I think we can replicate that model in healthcare through these educational initiatives, being a clarion voice for climate realism, telling people like it is, building a community of practice, thinking about adaptation and risk assessment, being unambiguous in the face of disinformation, and then leveraging our political capital together. So with that, thank you, and delighted to answer questions, I think.